The San Francisco Department of Public Health is giving what it calls supplemental shots of the Pfizer or Moderna vaccines to people who already received the single-dose Johnson & Johnson vaccine. While this does not currently align with the CDC nor the FDA's recommendations, the Department of Health says it is accommodating those who ask for it. KRON 4's Taylor Bisacki joins us live from our newsroom tonight with more on why they are doing this. Taylor.
Well, as you can imagine, Pam, this is stirring a lot of confusion. Again, this isn't recommended by the CDC or FDA at this point in time. And the San Francisco Department of Public Health says they're not recommending it either, but rather making accommodations. Many are now questioning whether this is safe or not, especially since other Bay Area health departments are not following San Francisco's lead on this. Getting a supplemental shot of Pfizer or Moderna vaccines into the arms of people who already received the Johnson & Johnson vaccine is now a possibility in San Francisco and has been for some time. That's according to the city's public health department on Tuesday. However, offering supplemental vaccine shots isn't currently recommended by the CDC or FDA. The city's public health department says they're not recommending it either, but instead providing accommodations for those who received the one-time Johnson & Johnson shot.
This was because we were getting some questions about a supplemental dose, and our clinicians did look at the literature, and there is no recommendation around this. It is an accommodation that if people have a discussion with their physicians and decide that they need a second dose based on a physician's recommendation and that discussion, that we would accommodate that.
The move is causing confusion for many, now wondering whether this is safe or not since it doesn't align with guidance from the CDC or FDA. Infectious disease specialist at UCSF, Dr. Peter Chin Hong, says he was surprised by the announcement on Tuesday, but says a supplemental shot to the J&J vaccine is safe.
We do believe that the J&J following a Pfizer or Pfizer followed by a J&J is going to be safe. We get this information from the UK studies because they had no choice but to mix and match in the time when there was vaccine shortage. And their data shows that it's very safe to get it and effective as well when you mix and match different vaccines.
As a reminder, the one-and-done Johnson & Johnson shot shows overall 66% efficacy against COVID-19, while the two doses of Pfizer and Moderna vaccines show about 95% efficacy. But Dr. Chin Hong says all three vaccines are above 90% effective in preventing serious disease, hospitalizations, and death.
At the end of the day, the standard regimen of the vaccines is what the absolute recommendation is. But if people feel nervous about just getting one shot of J&J, talking to the healthcare professional is probably the best advice that I would give.
Public health departments in Santa Clara, Marin, San Mateo, and Contra Costa counties responded to our requests on Tuesday and say they currently do not provide supplemental shots and will not do so unless the CDC or FDA updates its recommendations. Now, we also reached out to the remaining Bay Area health departments about whether or not they're offering supplemental shots to the Johnson & Johnson vaccine, but have not heard back yet. Meanwhile, San Mateo County's health department says it is aware of vaccinating providers who are giving or considering supplemental shots on a case-by-case basis. Live in the newsroom, I'm Taylor Bisacki reporting KRON 4 News.
All right.